A patent ductus arteriosis, or PDA, may be a diagnosis you hear about. Patent ductus arteriosis is a connection between your pulmonary artery, which is heading towards the lungs, and the aorta, which is going away from the lungs to the body. When the baby is in mom or during pregnancy, the mom acts as the baby's lung. Oxygenated blood goes from the placenta through the umbilical cord back into the baby and enters into the right side of the heart. Now typically, blood from the right side of the heart will go to the lungs and get oxygenated and go out to the left side of the heart. However, when the baby is in mom, the lungs do not work. Only 10% of that blood actually goes to the lungs. Like we said, the blood gets oxygenated by the placenta. So this blood actually goes through the patent ductus arteriosus, bypasses the lungs, and goes to the rest of the body. Now when a baby is born, they start crying, they start breathing. They don't need this patent ductus arteriosus anymore. The lungs are now functional. For term babies, this connection typically shuts down and closes within the first 72 hours of life. However, with micropreemies or extremely low birth weight babies, this connection sometimes stays open, and that becomes a problem. The problem occurs when the blood starts bypassing the lungs or gets shunted back into the heart. What you'll have is too much fluid overload in the lungs and the heart, causing problems, including respiratory distress. If that were to occur, babies typically have symptoms, including increased work or breathing, oxygen desaturations. At that point, the physician will typically order ultrasound of the heart to evaluate whether or not this connection is a problem. If they were deemed that it is a problem, there are multiple ways to address it. One, they can continue observing and hoping that the connection closes on its own. Two, they can administer a medication to help it close. Finally, they can have a baby be seen by a cardiothoracic surgeon who will actually clip and physically close that connection themselves.